Now, the Japanese government is now mulling the extension of the state of emergency as the medical system in the country's second largest city of Osaka nears collapse amid a rise in COVID-19 cases. Japan's western region accounts for a third of the country's total coronavirus death toll, even though it constitutes just 7% of its population. The speed at which Osaka's healthcare system was overwhelmed underscores the challenges of hosting the Olympics in about just 2 months' time. The problem has been further aggravated by the fact that only half of Japan's medical staff have been vaccinated. Medics are now warning against hosting this sports event.
でコロナに打ち勝った証ってコロナに打ち勝ってないんでね、今は。で、医療側とすれば当然、これ感染者数を抑えるということを第一に考えると、やはり人の集まりというのは避けていただきたいというのがこれは誰もが思うことです。
And now, WION correspondent Phoebe Amoroso is joining us live from Tokyo for more on this story. Phoebe, thank you so much for joining us. Japan is mulling extending current state of emergency as Tokyo reported about 535 new COVID-19 cases. What is the situation on ground right now?
So suddenly there is a concern that the cases still remain high. Tokyo's 7-day average has actually fallen. Over a week ago, it was over 800 new cases a day, and there's fallen to around 650. And as you said there are 500 new cases a day. Where the issue stands is that there is still a number of people with serious COVID-19 symptoms, and there simply aren't enough hospital beds in order to treat them, and there's a more widespread shortage of medical staff. Nationwide, over the weekend on Saturday, we saw the numbers of those with serious symptoms hit a fresh record high of 1,300. So that is why the government is considering potentially extending these emergency measures until June the 20th. That's the date that is currently being floated. No official decision on that as yet. But Okinawa, for example, was added to the state of emergency on Friday, and they will be under a state of emergency until June the 20th.
All right, now Japan has given a go-ahead to the AstraZeneca and Moderna jabs. This is in addition to the Pfizer that the country was already using to inoculate the people. Do you think this decision is enough to pace up the vaccination drive, or is it too little too late considering the Olympics are slated to begin in July?
So Japan has now obtained enough vaccines to cover its entire eligible population. With the Moderna vaccine, it's rolling that out in the large-scale vaccination centres in Tokyo and Osaka. Where the bottleneck lies is very much in attaining the number of medical staff. There is a shortage of nurses and doctors, and that was a shortage before the pandemic. So that's why the self-defense forces are staffing these large centres, and the government is working on regulatory changes. It has now approved dentists to administer these vaccines, and it is now considering adding pharmacists to the list.
All right, now as I mentioned earlier, medics are still advising against holding the Olympics. Are there any talks of cancellation in sight?
No, and that was quite a strong statement that we heard from the IOC Coordination Commission on Friday. They wrapped up a 3-day meeting, and IOC John Coates said that that the games would absolutely be held under a state of emergency, and that has added to the general public outcry here. An association of medical doctors and that represents 6,000 doctors or so sent a letter to the government calling on its cancellation. There are huge concerns as to whether it can be held safely. The IOC is pointing to the fact that they are offering vaccines to athletes, and they are going to be bringing additional medical workers to try and support the staff on the ground. And they said that this will make the Olympic Village one of the safest places in Japan.
All right, Phoebe, thank you so much for joining us with all those details. WION is now available in your country. Download the app now. Get all the news on the move.